to today's session. Our theme today is Yes, I can detect cancer early. Yes, I can survive cancer. We dedicate this International Women's Day to bring you awareness and debunk some of the myths regarding women cancers, women health, and its management. So today we have with us Dr. Amit Verma. He's founder and director at Dr. AV Institute of Personalized Cancer Therapy and Research. Thank you, Dr. Verma, for joining us.
Thank you, Payal.
I'm very excited to talk about personalized cancer therapy with you. This topic has been close to my heart as well. So we have a few questions for you, Dr. Verma. And the first question is, will population genetic testing help in early cancer detection?
Certainly. Most of us don't know that up to 20% of cancer, like breast cancer or ovarian cancer, are genetic in nature. Knowing the genetics at a population at large may help us to identify the individuals who are at high risk of developing these cancers. So the idea is the patients who are harboring the genetic alterations will be investigated, especially with the cancer screening, and the early detection is quite possible when you do that. So population genetics is certainly a very good approach to identify the cancer at an early stage. Whether it is feasible or not, that is at the policy level. But from the scientific point of view, yes, this is a very important approach.
Thank you. And the second is a little open-ended and a little teaching kind of a question. But can you explain us the benefits of precision medicine and is it for all cancers? So every cancer patient should do a precision medicine test?
So precision oncology or precision cancer medicine, or what we call as personalized cancer medicine, what I normally practice, is the treatment which you decide for cancer based on the tumor genomics or the patient genetics. When you utilize this information, you try to identify the right treatment approach for the patient. These kind of approaches are targeted approaches and sometimes also help us to identify the patients who may benefit with immunotherapy. These approaches, like target therapy and immunotherapy, are considered to be superior to chemotherapy in terms of response rate as well as low toxicities. There has been multiple published literature which suggests that the personalized approach or precision therapy approaches are superior to the conventional therapy in treatment for cancer. This approach is right now being applied to major cancers across the globe, including the lung cancer primarily, breast cancer, colon cancer. But the answer is yes, it can be applied to all cancers. It is just a sheer chance that when you investigate the patient, you may find some right genetic alteration for which you may have the right treatment. And if you apply the right treatment, you may expect a better response rate, a better duration of response, and less side effects. So yes, it should be offered to all the patients at the time of diagnosis, which I normally promote. But because of a lot of cost prohibition involved in this whole gamut of identifying the genomic alterations, we normally refrain all these things at the time of relapse or stage 4 metastatic settings.
All right. Yeah. Point well taken. And the last is, do you have any message for us women on this International Women's Day?
I think women are the one who drives the whole world, and I salute to them. And it is the responsibility of the whole society to encourage them to come out from their comfort zone and come up with the idea of surveillance for cancer screening. And I promote all the women to meet their gynecologists, oncologists, general practitioners, and start their cancer screening from the age of 40. And if there's any family history, if they want to share with their doctors, they should also undergo some kind of gene testing to identify if they are at a higher risk, and the screening will start earlier in those cases. So salute to all the women in this Women's Day.
Thank you so much, Dr. Verma, for wishing us and for sharing your pearls of wisdom. Thank you.
Thank you very much. Have a nice day. Bye bye.